Doctors at Sham Hospital are waging a life and death battle every day. Even before the earthquake, the hospital was struggling to cope after more than a decade of civil war. Sham Hospital was badly damaged by the quake, but survived.
Our hospital was near 3 children's hospitals. All were demolished because of the earthquake. Therefore, we are doing the work of 3 hospitals. The area was suffering before the earthquake because of limited aid. Hospitals were not working properly. But after the earthquake, a disaster happened.
Sham Hospital has lost staff to the quake, along with valuable equipment. It's a story that is repeated across the rebel-controlled Syrian Idlib province, and now the medicine is running out.
During the first 12 hours after the earthquake, we exhausted all the medical stocks. So we had to start relying on local associations and organizations, and even individual donors to secure medicine to save these injured. On the 5th or 6th day, aid began to enter, but so far, everything that entered only covers 10 to 15% of our needs.
But some positive news. 2 new border gates from Turkey to Idlib province have been added to the Bab al-Hawa crossing point, facilitating the faster delivery of urgently needed supplies.
This one gate, Bab al-Hawa, was not enough to deliver aid logistically. Let's say you want to send 1,000 trucks to go through one gate, that would not be possible in one day. That will take like a week.
Aid cannot come fast enough for those quake survivors. They have lost the little they had and are now trying to stay alive as the threat of illness stalks the tent camps.
Our children have a fever and need medicine. They also need treatment for sore throats. We are struggling. The simplest things are no longer available. The hospitals have nothing, even painkillers for our children. They tell us they have nothing as the aid has run out. So we are in dire need.
With many survivors packed into tents in freezing winter conditions, doctors warn disease and infection are now the new threat and challenge to a medical system that's working beyond breaking point. Doreen Jones for VOA News, Istanbul.